I would say I have a lot of conversations with executives, and they're always saying, well, Sanjula, like the data just doesn't make sense, right? With like these low volumes utilization, it must be because the technology isn't mature, or, we haven't educated the market enough, right? There's a lot of this kind of trying to justify the kind of drop off in utilization. But to what we just talked about, what we see very clearly in the data is there are distinct patterns in the things, of what patients and providers are using the telehealth for, and then also the kind of consumer preferences, right? So another thing that's really important to think about is we're all consumers and all are unique in our psychology, right? And so just like you and I may have different preferences for how we like to grocery shop week to week. And if we go to one store, multiple brands, or if we do it all in person or all virtually or some combination of the two, it's the same thing for healthcare, right? And so that's another layer that we see in virtual care where, when you kind of layer in the clinical use case, so even for behavioral health, like we talked about, then even amongst all individuals who are maybe eligible or seeking care for behavioral health services, there is a faction of consumers who just say, that's just not my preferred mode in which I want to interact, right? For whatever reason, whether it's, someone might say, I don't think it's the same level of quality. That's perceived quality. So I think, in person is better, or vice versa. Somebody says, I think the quality is the same and convenience matters to me more. So I'm going to do that. So that's another important factor to kind of think about when we size up the market and kind of think about the total addressable market, if you will. I think the third piece is when we think about provider strategy, for so long we've been using this term, the digital front door. And so a lot of our research has really actually tried to evaluate the effectiveness of the digital front door, which I haven't seen much literature or other data out there of people actually validating that strategy. And so this is something we've spent a lot of time trying to do. And so what we've done is actually track patients. Okay, if you go use virtual care or receive some type of care virtually from, health system A, right? What else do you do at health system A, afterwards, right? Maybe not right away, but even months later, years later, like, does that create that stickiness or that relationship that we tout in terms of the digital front door? And what we see in the data is it's not actually the case, right? So just because a patient engages with your provider organization for something virtually doesn't mean they're going to come to you. They're more likely to come to you for other high acuity, high margin services, which is a big kind of factor that a lot of health systems have been saying is why they want to invest, right? Is that we want to be more consumer centric. We want it to be a front door. We want it to be a funnel for patients, right? And, one of those reasons is because virtual care has made things more fragmented, right? And it is more of a consumer play for things that are low acuity, where people are going to be more transactional. So just like grocery stores, right? When they're not making the connection just because I, went to that health system to get a rash, checked out, that, oh, when I need a full-time dermatologist, am I going to go back to that? Or, am I going to go to my primary care or something else and get a different referral? They're not necessarily thinking about that. They're here in the moment trying to figure out, where to get what care. So there are some exceptions to the rule, but I think this notion of the digital front door has been flawed, and that's been misguiding a lot of the investments that have been made so far. And the data speaks for itself in terms of the return on investments that many of those providers have actually, gained.